In this video, we will be continuing our study of the mediastinum, and we will talk about the nerves and lymphatic structures of the mediastinum. So our learning objectives are to describe the origin, termination, course, and anatomical relations of the thoracic duct and right lymphatic duct and describe the territories they drain. We also want to describe the course, anatomical relations, and branches of the phrenic and vagus nerves in the mediastinum. And then lastly, we will describe the location, anatomical relations, and branches of the thoracic part of the sympathetic trunk. And here, our special guest is going to be Dr. Ferguson. So let's get started.
All right. Hello again. Dr. J here again. Thank you, Dr. Olson-Long. Thank you, awesome students. Hey, check this out. Yay, spotlight. Spotlight on what? The lymphatic structures and nerves of the mediastina. So let's get going. So you remember our old buddy, the phrenic nerve, or phrenic nerves, right and left. Of course, phrenic nerve, branch of the cervical plexus, which contains fibers from the ventral rami, of course, of C3, C4, and C5. C3, C4, C5 keep the diaphragm alive. So ventral rami of C3, C4, C5 spinal nerves. Now the right phrenic nerve specifically descends along the right side of the right brachiocephalic vein and superior vena cava, passes anterior to the root of the right lung between the pericardial sac and mediastinal pleura. And it reaches the diaphragm on the right side of the inferior vena cava. Right side of the inferior vena cava. Terminal branches supply the central part of the peritoneum, covering the inferior surface of the diaphragm. And of course, peritoneum is associated with the abdominal structures, right? But worth noting, innervation coming from phrenic nerve in that to supply the central part of the peritoneum covering the inferior surface of the diaphragm. That is worth noting here. Now, phrenic nerves are accompanied by, again, fancy word here, very long fancy word, pericardiophrenac vessels. Now, what does the phrenic nerve innervate, right? Well, motor fibers, of course, innervate the diaphragm, and the sensory fibers for the pericardium are fibrous and parietal layer of the serous, and then mediastinal pleura and central part of the diaphragmatic pleura, central part of the peritoneum covering the inferior surface of the diaphragm. Pain caused by irritation of structures receiving sensory nerve supply from the phrenic nerve is referred to the shoulder region, or the C3 to C5 dermatomes. Again, you're going to talk about this more in your diagnostic courses. But so once again, just to mention real quick, right phrenic nerve descends along the right side of the right brachiocephalic vein and superior vena cava, passes anterior to the root of the right lung between the pericardial sac and mediastinal pleura, reaches the diaphragm on the right side of the inferior vena cava. Terminal branches supply the central part of the peritoneum covering the inferior surface. Now that left one, right, crosses the left side of the aortic arch, passes anterior to the root of the left lung between the pericardial sac and mediastinal pleura, reaches the diaphragm close to the apex of the heart, and terminal branches supply the central part of the peritoneum covering the inferior surface of the diaphragm as well. So don't forget, right and left phrenic nerves, right? Pretty much same trajectory, but, just make sure you pay attention in your notes there. And note the innervation, because, again, it's not just the motor innervation that you want to remember. You want to remember those sensory structures mentioned there that phrenic nerves supply as well. Now, of course, we focused on the motor in DAA, but you want to take note of that sensory component as well. Please, please, please pay attention to your notes. Now, as far as the vagus nerve goes, remember our old buddy the vagus, cranial nerve 10. And we're going to talk about him as well in right or left. So the right vagus nerve enters the superior mediastinum and lies between the right brachiocephalic vein and brachiocephalic trunk, descends lateral to the trachea and medial to the arch of the azygous vein, passes posterior to the root of the right lung, and gives branches to the pulmonary plexuses, which passes onto the esophagus and takes part in the esophageal plexus. Branches of the right vagus are distributed primarily on the posterior surface of the esophagus. Now, why show you an image like this? Because it's showing you the right side by itself. So here's that right vagus nerve, right? Cranial nerve 10 seen here. And the left vagus nerve, which we'll switch to that view, left vagus nerve enters the superior mediastinum between the left common carotid and the left subclavian arteries. Posterior to the left brachiocephalic vein, crosses the left surface of the aortic arch, passes posterior to the root of the left lung, and gives branches to pulmonary plexuses, which passes on to the esophagus and takes part in the esophageal plexus. Branches of the left vagus are distributed primarily on the anterior surface of the esophagus, whereas the right, remember, primarily distributing on the posterior surface of the esophagus. Close to the diaphragm, the esophageal plexus forms two trunks, an anterior and posterior vagal trunks, which pass through the esophageal hiatus of the diaphragm together with the esophagus to enter your abdomen. Now here is your left vagus, right? Now cadaverically, you follow that left vagus. We know that it's going to spit off this little branch here called the recurrent laryngeal nerve, but we'll come back to that. Now, thoracic branches of the vagus nerve, branches that carry preganglionic, parasympathetic, and visceral sensory fibers to the thorax organs or thoracic organs, such as the esophagus, the trachea, the bronchi, the lungs, the heart. Visceral sensory fibers and vagus nerves relay information to the central nervous system about normal physiological processes and reflex activities. They do not transmit pain sensation, right? No pain sensation. But physiological processes and reflex activities, yes, vagal. Now, continuing on. As I mentioned, that left recurrent laryngeal nerve, staying on this image, the left recurrent laryngeal nerve originates from the left vagus nerve as it crosses the left side of the aortic arch, passes inferior to the aortic arch, and posterior to that ligamentum arteriosum. So cadaverically, you trace on the left side, you trace it down and see that little branch twisting up or hugging up underneath the aortic arch. And then right next to it there, you would see that ligamentum arteriosum. Now, it ascends towards the larynx, of course, hence the name recurrent laryngeal, and the groove between the trachea and esophagus on the left side. So cadaverically, you can even, find that groove there in between the trachea and the esophagus and follow that recurrent laryngeal nerve on the left side, the recurrent laryngeal nerve on its course towards the larynx. Now, this innervates most of the laryngeal muscles on the left side, by the way, and its lesion causes paralysis of the left vocal cord, which results in hoarseness. No, it doesn't turn you into a horse. Of course, it means, a hoarse voice, right? Where you can hardly talk. So the right recurrent laryngeal nerve originates from the right vagus nerve in the root of the neck, has a higher origin than the left recurrent laryngeal nerve, and it curves around the inferior aspect of the right subclavian, very close to its origin from the brachiocephalic trunk. So again, on the right, cadaverically, sometimes, you can see it, but cadaverically, sometimes it's a little harder, right, to find that because it's kind of up in, up more superiorly. It doesn't line right up with the left. That left recurrent laryngeal is usually a little more identifiable, at least cadaverically, but, definitely possible and capable of finding both, of course. Now, if we go to an image like this, which again, I know it's a little more cartoonish in nature, but I like to show because especially on that left side, you can see that left recurrent laryngeal, and then of course you can see the esophageal plexus here, or plexuses. And then continuing on, we want to now move into, or if I go to this, now you can see right alongside here real quick, I know I'm focusing on this a lot, but it's important because left vagus nerve coming down, left recurrent laryngeal nerve coming just posteriorly placed there to the ligamentum arteriosum, and of course wrapping underneath that aortic arch. But on the right side, remember that right recurrent laryngeal, see, it's hugging up underneath the subclavian artery here, kind of close to where it's, where the common carotid here on the right is going to branch off as well, but it kind of tucks underneath there. But notice the levels are off, right, because you don't have two arches, of course, coming off the heart for one thing, but it's just taking a different course to get there. Remember, it's all about real estate in the body, right? So easiest access somewhere, that's what the body is going to do. Oh, too crowded around here. Let's just dip back under here. This guy's like, bruh, I'm spitting off early. I'm going back up. So let's talk about some lymphatic structures, shall we? Now, the thoracic duct, which again you might remember from DAA, baby, is the largest lymphatic channel of the body. Now remember that thoracic duct is draining most of the body, right? A much larger distribution or drainage of thoracic duct than the right lymphatic duct. But again, thoracic duct is a large lymphatic channel of the body, begins in the upper part of the posterior abdominal wall, roughly the L2 level, sometimes begins as a dilated sac known as the cisterna chyli, which again, from DAA, we talked about this being the origination of that thoracic duct, and it usually is. But many times, or I should say that's what you usually hear discussed, but really, it more often it begins by direct confluence of the right and left lumbar lymph trunks and intestinal lymph trunk, which collect lymph from the lower limbs, pelvis, and abdomen. Now, of course, this thoracic duct as well is going to have to pass through the diaphragm, the aortic hiatus, ascends in the posterior mediastinum, posterior to the esophagus, with the azygous vein to its right and descending thoracic aorta to its left. So again, cadaverically, you look for those structures and you can find that thoracic duct as well. Now, at approximately the level of T5, it inclines to the left and ascends along the left side of the esophagus. So we switch sides there to see it's kind of veering off there to the left, and then to ascend up through that superior thoracic aperture. And then in the root of the neck, it arches to the left, posterior to the left carotid sheath, contains left common carotid artery, left vagus nerve, and left internal jugular vein, that left carotid sheath. And it terminates at the union of the left subclavian and left internal jugular veins. So you can follow that course in this image all the way from that cisterna chyli. And again, I know that this is what's going to usually be discussed in a lot of textbooks, at least visually, beginning at that cisterna chyli, and then coming up and then veering off to the left there, and then eventually arching over to drain into that union of the left subclavian and left internal jugular veins. Now, continuing on with the thoracic duct, it receives left jugular, left subclavian, and left bronchomediastinal lymph trunks, and they may drain directly into the adjacent large veins as well. The thoracic duct conveys to the venous circulation all lymph, again, from the lower limbs, the pelvis, the abdomen, the left side of the thorax, and the left side of the head and neck, and left upper limb. So what's left, right? It's just the right side of the head and neck, and then the kind of that upper right portion of the thorax, and then the right upper extremity. Everything else in the body, as you can see listed again, or remember from DAA, pay attention to your notes there as well, that Dr. Olson Long has given you, but much larger distribution, or drainage, I should say, of the thoracic duct. But we do need to talk about the right lymphatic duct as well. And The right jugular, right subclavian, and right bronchomediastinal lymph trunks may join to form a short vessel known as the right lymphatic duct, which terminates at the union of the right subclavian and right internal jugular veins. Drains lymph from the right side of the thorax, as I mentioned, the right side of the head and neck, and the right upper limb. And then again, 3 trunks may open independently into adjacent large veins. So, there can be some variation, but this is what you're going to see a lot in textbooks. Now, again, you may have seen this image before, but it's a good image to show you structures that are draining into, and you can follow the course of the thoracic duct and the right lymphatic duct. Remember, you don't have a right and left lymphatic duct. You have a right lymphatic duct and a thoracic duct. And remember that cisterna chyli as a possible, and I mentioned quite a bit, obviously, the beginning of the thoracic duct there. But pay attention to those variations. Now, lastly, we want to talk about nerves. So you might remember that DAA, right? We talked about the sympathetic trunk, right? So here we're going to focus on the thoracic portion of that sympathetic trunk. Now, it's continuous above with the cervical part of the sympathetic trunk, of course, and below with the lumbar part, but we have to focus in on the thoracic portion here. It usually consists of 11 or 12 ganglia connected to each other to form a continuous chain. Remember, the first thoracic ganglion often fuses with the inferior cervical ganglion to form the cervicothoracic or stellate ganglion. There is one trunk on each side of the thoracic vertebral column, which you might remember. The superior mediastinum sympathetic trunk lies anterior to the neck of ribs. As it descends, it becomes progressively more medial until it lies on the lateral aspect of the bodies of the lower thoracic vertebrae. Throughout its course, it's covered by parietal pleura. Now, branches, right? All ganglia are connected to corresponding intercostal nerves by, remember these guys or girls, white and gray communicating rami. Now, the upper ganglia, usually the upper 4 or 5, give off branches to the thoracic viscera. Remember, you might remember that from DAA as well, right? T1 through 4, maybe T1 through T5, talking about the heart, right? But these levels can also give off to the aorta, bronchi, lungs, esophagus, and contain post-ganglionic, sympathetic, and visceral sensory fibers. Now, remember splanchnic nerves. 3 thoracic splanchnic nerves, the greater, the lesser, and the lowest or least, they might call it, originate from the lower part of the thoracic sympathetic trunk, meaning the 5th ganglion and below, pierce the corresponding crus of the diaphragm and terminate into prevertebral ganglia. But remember, those greater, lesser, and least splanchnic nerves, or lowest splanchnic nerves, are taking those preganglionic sympathetic and visceral sensory fibers to those prevertebral ganglia. But remember, those prevertebral ganglia are in the abdomen, but we still have to mention them here. Okay, so again, the 3 thoracic splanchnic nerves, greater, lesser, and lowest or least, originate from the lower part of the thoracic sympathetic trunk, usually the 5th ganglion and below, pierce the corresponding crus of the diaphragm and terminate in prevertebral ganglia in the abdomen. And again, they're going to contain preganglionic, sympathetic, and visceral sensory fibers. Remember, preganglionic if they're in the splanchnic nerves, because they're traveling towards those prevertebral ganglia, which are in the abdomen, to synapse, right? So they have not synapsed yet, so that's why they're preganglionic. But again, you're going to get a lot of that in neuro as well. Now, the greater splanchnic nerve, now you do want to pay attention to these levels, guys. Please, you did not have to remember that for DAA, but you do have to for gross anatomy. So the greater splanchnic nerve usually originates from the 5th to the 9th, or sometimes 5th to the 10th ganglia. The lesser splanchnic nerves then originate from the 9th and 10th, or 10th and 11th. And the lowest or least splanchnic nerve originates from the 12th ganglion. So just Look at your notes, pay attention, look at those levels. DAA, you just needed to remember greater, lesser, least, and what they were carrying, but you do want to pay attention to the levels here. Now, visceral sensory fibers containing these branches carry pain sensation from the thorax and, of course, the abdominal organs. Again, focusing more on the thorax here. So again, noting this image here, remember you have the sympathetic trunks on either side. Of course, we're focusing on the sympathetic, the thoracic portion of the sympathetic trunks here. Do not forget about your greater, lesser, and least splanchnic nerves, the levels that are forming them or they're running to and from. And remember a little bit about what they're carrying, right? Fiber types, right? Now the lymphatic section there, guys, please make sure you take note of that because I know that lymphatic structures don't get talked a lot about in systemic anatomy courses, but now in gross anatomy, you're talking about lymph drainage quite a bit, and you will in gross 2 as well. So thank you so much, everyone, once again, and thank you to Dr. Olson Long, and remember, you are awesome.
So now, our dancing people out too quick, you should be able to describe the origin, termination, course, and anatomical relations of the thoracic duct and right lymphatic duct and describe the territories they drain. You also should be able to describe the course, anatomical relations, and branches of the phrenic and vagus nerves and the mediastinum, and be able to describe the location, anatomical relations, and branches of the thoracic part of the thoracic or the sympathetic trunk. So now let's bring up those dancing robots in person.